Hi everyone, I want to talk to you about Lp(a). This is a test that we are increasingly doing more as part of cholesterol monitoring, cardiovascular disease risk stratification. Lp(a) is a particle that carries cholesterol in the blood, just like LDL, which is our bad cholesterol. Lp(a) is predominantly genetically determined, and it is an independent risk factor for heart disease. Besides genetics, there are other factors that can increase Lp(a). Ethnicity plays a role, so Black individuals of African descent and South Asian populations often have higher Lp(a) levels. Conditions like diabetes, chronic kidney disease, and postmenopause can also increase Lp(a). May be saying, I've had my cholesterol checked so many times and I've never had this done. And the guidelines vary. There are some organizations that recommend everyone get this checked at least once in their lifetime, and then others are a little bit more specific and recommend checking, as you can see here, if you have a family or personal history of premature heart disease, known family history of high Lp(a), diagnosis of familial hypercholesterolemia. So it really depends on the guideline that you are looking at. And if you do have high Lp(a) levels, it really helps us think about your cardiovascular risk kind of beyond just your lipid profile. This study was published last month in JAMA Cardiology, and they looked at nearly 28,000 women and their 30-year risk of heart disease based on their Lp(a) levels. The red line in these graphs are people who had the highest Lp(a) level of greater than 120 milligrams per deciliter. And if you're getting a check, there are different values and measurements. You want to keep that in mind. But the red line correlated with the highest risk of cardiovascular events and cardiovascular death, again, supporting that Lp(a) is a cardiovascular risk factor. So why am I talking about this as an oncologist? And that is because a lot of the cancer treatments that we give increase cardiovascular risk. And I think that for the right person, adding Lp(a) testing can help us better understand that cardiovascular risk, can help us better guide our patients, can help us figure out, do you need additional cardiovascular medications, monitoring with a cardiologist, and so forth. Given there is some data showing that menopause impacts Lp(a) levels and can raise them, there's obviously a lot of question about how do we think about this in light of premature menopause and our patients going through ovarian suppression and our patients are on endocrine therapy and hormone lowering medications. So these are something that, it is important. And I think the biggest challenge for us as we think about cancer treatment is to make sure that we're also protecting the heart. And one of the ways is really good risk stratification. And so I think of Lp(a) as maybe an additional marker that we can use to help that risk stratification, in addition to blood pressure, cholesterol, coronary calcium scores. Have you had Lp(a) checked? If not, this may be something you might want to talk to your medical team about.